So interestingly enough, as I said before, when I was a child, I used ortho-K, and I didn't know back then, and there was no research into this, but now there is research that ortho-K causes like a peripheral defocus effect, and that slows down myopia progression. Other treatments that include low dose atropine. So that's clinical studies have shown that differing concentrations of low dose atropine can help slow down myopia progression, and this can be tailored to your child. And special myopia control glasses. So these are what we call peripheral defocus glasses. And there's also new ones coming on the market, like, dot glasses, as well as, varying technologies that are coming on. And it basically causes a peripheral defocus, and the dot lenses, I think, cause difference in contrast on the retina. And these have been shown to slow down myopia progression. And the third, treatment on the market at the moment is for, recalcitrant myopia, like myopia progression that doesn't respond to all of the previous treatments. There is red light therapy, which involves, twice daily sessions of 3 minutes of red light therapy to the retina. That basically increases choroidal blood flow to the eye, and that strengthens the sclera, the white bit of the eye, so it stops growing as long. And that's very effective. It's definitely very effective, but it does need to be monitored closely. So children need to have regular, macular scans and fundus checks to ensure that, it's not affecting their eye health. So far, the evidence has been, fine as long as there's no other ocular with that treatment. And so, yeah, there are so many treatments now, and there's more and more research, every year. So as time goes on, there'll be more and more therapies. I'm hopeful that we're going to keep everyone as a low myope so that they can all get laser and not have any, major ocular comorbidities.
I've heard some optometrists talk about combination therapies where they might use atropine
Mm.
plus myopia control glasses, or plus atropine plus I think there are contact lenses now as well, aren't
Yeah,
there? Like,
there's also MiSight contact lenses that are peripheral defocus. Yeah. So actually combination therapy is how I usually manage my children, because I want to make sure that they can see well, and when they get their correction, like either glasses, ortho-K, or MiSight contact lenses, that I want to put a bit of myopia technology, control technology into that. And at the same time, I also then give them, low dose atropine, and I titrate it based on their tolerance and their growth. So I always do combination therapy because I feel like it's most effective. Obviously, if children cannot tolerate the combination of the two, I sort of, tailor it to what they can tolerate to, have the least amount of progression.
so just a random question. Does nutrition play any role in myopia? Is there any sort of research around that?
So far, there's no obvious, nutrition that can make myopia, slow down or not progress. But I assume just a good balanced diet for your child with good fish oil, good vitamins, that in itself will be good for ocular health, which will be good for myopia as well.